Good evening. I'm Dr. Edmund Creekmore, a licensed clinical psychologist and the National Shattering the Silence Coalition Education Coordinator. Welcome to our Pro Talk for September 2024. We are pleased tonight to welcome Heidi Brelsford for our quarterly September Pro Talk. Heidi will be doing a much anticipated presentation on Social Security eligibility and Medicaid benefits, covering such topics as basic eligibility, age and disability requirements, Medicaid waiver requirements, which vary greatly by state, medical benefits, and special topics such as survivor benefits. A little about Heidi's background. Heidi is the founding president of Schizophrenia and Schizoaffective Society, located in rural northern Illinois, a nonprofit. Heidi was a professor of communication studies at Elgin Community College for 24 years. In the past 10 years, she has held a variety of positions in marketing for the medical and pharmaceutical industries. Currently, she owns and operates Haven Legacy Brands, a small marketing agency. Heidi is also a full-time paid caregiver for her son through the Illinois Department of Health and Human Services Division of Rehabilitative Services. Heidi speaks to these issues from her own personal experience during state and federal disability benefits for her own child who is on the psychosis spectrum. Heidi has 3 grown children, with her youngest having schizoaffective for the past 10 years. Heidi began successfully navigating and securing federal and state disability benefits on behalf of her adult son 6 years ago. Because of the interest we know there is in the topics Heidi will be covering tonight, we ask, if you have a question, that you place it in the chat. Heidi's presentation is planned for 30 to 45 minutes with a 30-minute Q&A. Please welcome Heidi Brelsford.
Thanks, Ed. Hi, everybody. I'm so happy to be here to share this important information. Tonight it's great to see so many people on the call, too. Thank you for that. 6 years ago, my adult loved one was officially diagnosed on the psychosis spectrum with schizoaffective. And it's my hope that by sharing my experience, more people will apply for benefits, will advocate, and will spread the word that our loved ones are part of the disability community and that they qualify for and they deserve disability benefits. As Ed mentioned, my name is Heidi Brelsford and I live in Illinois. I'm here to tell the story of applying for and securing federal and state disability benefits. My adult son. I feel like I have a lived experience PhD going through the benefit application process. Although I have no formal training, since we're limited in time, I gave a lot of thought to what I wanted to focus on in this talk, because there's no way to cover everything in 35 minutes. So instead, I decided to focus on the things that I wish I would have known. So key takeaways. This is the concept, the acronyms, the processes, the things I wish someone would have told me before I started the application processes for my son. That's what I'm going to focus on today. So today I'm going to go over applying for Medicaid and SNAP and cash assistance if you have it in your state. I'm going to be speaking to my experience through Illinois because that's where I live and that's where I went through the process for applying for Medicaid. Also applying for a Medicaid waiver program through the Department of Health and Human Services, Division of Rehabilitative Services, which we call DOORS. And the last part of my presentation, I'm going to talk about applying for SSDI, SSI, Medicare, Medicare Part D, the Extra Help Fund, through the federal government. I have an unmarried adult disabled child who lives with me. I'm his primary caregiver. You may have a different situation. Maybe your adult child doesn't live with you. Maybe you are a person with SE or SBA yourself today wanting to learn about how to apply and qualify for these benefits. I can only share what I do, and I hope there's enough general information in what I share so that everybody leaves with what they came here to get tonight. I'm going to be speaking today specifically about my experience, so I'll be talking mostly in the first person. And I'm not in a position to give advice on what you should do or you should not do, but I am going to tell you in detail about what I did and what I learned during that process. Securing disability benefits gives our adult children some levels of protection now and also after we're gone. It links them into a system so that they'll be more likely to access a caseworker and less likely to fall through the cracks after we pass away. But we're not going to live forever. What happens to our children when we're not here? Provide for them and look out for them. I know that this is top priority of every parent I talk to who is walking in my shoes right now. Having these benefits, they keep families together. It eases the financial burden of caregiving. These benefits combined together are major support to being able to stay in your home and in your community and have the resources that you deserve. A little bit of history about Social Security and psychosis spectrum disabilities. Schizophrenia and psychosis spectrum disabilities are among some of the oldest illnesses recognized by the Social Security Administration as qualifying for first application approval of benefits. Psychosis spectrum disabilities, schizophrenia, schizoaffective, bipolar with psychosis, and other psychosis spectrum disabilities are on a very short list for the Social Security Administration as already recognizing them for approval. These benefits have been designed for you. These benefits are not a handout. You are a productive citizen, even when you're receiving these benefits. You are entitled to these benefits so that you can live a more secure life, so that you can be safe and well, and you can take care of your family. First, let's talk about the benefits available through the state. Let's start with Medicaid. These benefits, Medicaid and SNAP and these public benefits in your state, that should be your first stop. That should be the first benefit program that you apply for. When it comes to these programs, every state is different. So I can only speak to my experience with Illinois and hope that gives some insight. You're going to want to do research on your state before you apply. I went online to apply for Medicaid, and here's some key takeaways. Here's what I wish I would have known before I applied. First, the idea of understanding fair share. In order for my adult child to receive the maximum benefit or come at least close to the maximum benefit for these programs, I have to claim him as fair share. What fair share means is that I split the bills with my loved one. My adult child pays the rent and utilities and pays for his own phone, food, and necessities like toiletries and clothing. We keep his food separate from mine, and he participates in shopping for it and preparing for it. Fair share this same fair share, the way you set up your finances in your home, the way you may have to make changes to set up fair share in your home for Medicaid will also be what you report to qualify for Social Security, SSI. So you want to be consistent. the federal and state governments, they talk and they compare notes and they compare applications from your Medicaid application to your Social Security disability benefits application. So you want to have consistency. So it's good to know what fair share is, how to create that before and during the application process so that you're aligned with the rules for Medicaid and for Social Security disability. Secondly, my adult child is considered his own household. This was so confusing to me when I did the Medicaid application. When the application asks you how many are in the household, it is not talking about how many people live in your house. The answer is 1. When the application asks you to list all other individuals living in the household, the answer is there are no other individuals. Your loved one who's on the psychosis spectrum is their own household. When the application asks you to document household income from every member of the household, I only put my adult child's income because my adult child is a household of 1. Let's talk a little bit about rent. The application will ask you to write in how much your adult child pays in rent. Look around and get a sense of how much a room is to rent in your area if they live in your house with you, and set an amount for rent. The application will ask if they pay utilities, and the answer is yes. Designate a utility that is paid by your adult child. For example, my son pays the water bill. Next, the application will ask you if you claim this person as a dependent on your taxes. The answer is no. Even if you did last year, in order to qualify for these benefits, you can't claim them as a dependent on your taxes anymore. If you do, then you'll be considered part of their household and your income will be included in the income test for them to be able to qualify for Medicaid, which in most cases means they would be disqualified for Medicaid. So the price we pay is we no longer claim our children, our adult children, as dependents on our taxes. So I checked no, and from that day on, I no longer claimed my son as a dependent for my state or federal taxes. This also means that I can't file as head of the household anymore. The application is going to ask you, what do you want to apply for? And you want to apply for everything. You want to apply for Medicaid, the health insurance. You want to apply for food benefits, SNAP. You want to apply for cash assistance. Whatever your state has on there that you can apply for, you just click all of them. You want to apply for all of them. The caseworker, once you start going through the approval process, the caseworker that's working with you on your application will provide feedback about what you are going to be qualifying for, what you shouldn't be qualifying for, what what should be checked yes and what shouldn't be checked yes. That will give you feedback and information about that, but just start out with checking everything. In Illinois, the next step after I submitted my application was to have an interview with the caseworker from Medicaid. So in Illinois, I was given a choice of going in or checking a box for a phone interview. And obviously I can't go in with my son, and most of us can't. So I checked the box for a phone interview. The state sent me a date and time that I must be available for the call. And you don't want to miss this call because you may have to resubmit your application in order to get another call. So make sure you are there in a quiet room and you're able to take this call. They will confirm what you put on your application. So it's a good idea to print out a copy of the application before you hit submit. And then this way, when you're having the interview, you'll be looking at the same thing that the interviewer is. And it makes the interview just go a lot smoother when you're collaborating like that. Wish I would have known that ahead of time. During the interview, you should include additional information. You can talk about your diagnosis or your loved one's diagnosis, their level of disability being 100%, and just share a little bit of information. I asked the interviewer if there were any additional programs that they could suggest that we might qualify for, because I was at the beginning of the application process and I did not know anything about applying for benefits prior to this. And when I asked this question, the person that was having an interview with me for Medicaid told me about the Medicaid waiver. I had never heard of Medicaid waiver, but that's how I found out about it. She said, you know what, from what you're telling me in your application, it looks like your son may qualify for a Medicaid waiver. You should take a look at it. Had no idea what it was. She didn't have time to explain it. She just mentioned it, and I jotted it down when we were talking. So who knows what programs might be available? It's worth it to ask everybody along your application journey. What else is out there? What else should I be aware of? Or is there anything else you can think of that I should know that I don't know, because I don't know what I don't know? You'll be surprised at what at where that will lead you. Let's talk about waivers. Medicaid waiver. The word waiver can be interchangeable with the word program, and it's easier for me anyway to think about it when I think about it as a program. It's a program of benefits for people with disabilities. So what is a Medicaid waiver program for people with psychosis spectrum disabilities? Well, in Illinois, it's the same waiver program for all adults with disabilities. In Illinois, the Department of Rehabilitative Services, or DRS, DORS, oversees and administrates this waiver program. Illinois has 9 Medicaid waiver programs, and these 9 Medicaid waiver programs provide benefits for 9 different types of people with different needs and disabilities. So the takeaway here is for you to do research in your own state. Find out what Medicaid waiver program applies to, what's it called, and what applies to you. You can always call your Department of Health and Human Services and ask and give some information. It's just, it can feel, when you're calling, it can feel a bit like a wild goose chase. Don't give up. Just keep calling so you get someone that can explain these things to you, or you can find it online, but honestly, a lot of times it's pretty buried online. Some of the things that this program, that the DORS program in Illinois provides for my family is in-home caregivers, which include family members as paid caregivers. And I'm a paid caregiver for my son. And in Illinois, after a certain amount of criteria is met as a paid caregiver, we also get benefits. We get paid time off, and we get health insurance through the state. In Illinois, we're even unionized. So whoop, whoop for that, right? I am part of SEIU, local number 4. And our union fights for us to be able to make a living wage and have benefits, and advocates for us. And the state also is on board with the Medicaid waiver for us as well. The Medicaid waiver provides transportation to and from medical appointments for my loved ones, provides special equipment like blood pressure cuff or a life alert subscription and a life alert button. The Medicaid waiver program provides a caseworker that comes to visit the home periodically and help to coordinate care and just helps in so many ways. And in the beginning, I was very nervous about having a caseworker come to my home. And I was worried about having someone from the government come in my home, just in general. But after the very first visit, that all went away. The caseworker was 100% about finding ways to improve my son's quality of life, support our family, check on my son. I've asked the caseworker things like, on the day I draw my last breath, what's going to happen to my son? And he had very specific plan of what would happen, how he would be involved. I sleep better at night now that I have a caseworker involved. And this was a very big and important part. All of the Medicaid waiver was very big and important part of stability for my son and for my family. And the caseworker is no exception. The rationale behind a Medicaid waiver, really, it does start with compassion. And this is my experience of it. It really is about keeping disabled people out of institutions and in their community. But it is also about financial from the state's perspective, because when the state pays me or us to keep our loved ones safe and comfortable in their homes, it's much less expensive than for the state to pay for a nursing home, a residential facility, a group home, a prison, or state hospital. Medicaid waivers save states a lot of money. There's vast differences between states regarding Medicaid waivers. Some states have no waiting list. Some states have laws making waiting lists for Medicaid waivers illegal. It's against the law. They can't have a waiting list. Illinois is one of the better states for Medicaid waivers. Some states like Florida and Texas have wait lists that I've heard can be as long as 10 years, which is completely unacceptable. Some states do not pay caregivers, or they have a lot of restrictions, or if they do pay, they pay a little wage, they don't provide benefits. Not all states' caregivers are unionized. You'll need to do research on what is being offered in your state and understand that my examples today are based on my experience in Illinois. But I want to share my experience because I want you to also feel like if you're in a state that's not providing what Illinois is providing, I want that to light a fire for all of us to do better and to advocate in a way that the Medicaid waiver program statewide for all states is expanded and that it is fully funded because it's just so vital. I found the online application for Medicaid waiver program after the caseworker suggested it on my Medicaid interview for Illinois. It was a really short application, basically just my name and address, and that's about it. And shortly after that, I was contacted by a caseworker who gave me a list of information that I would need to provide and an interview date. So I provided the information, I filled out the application, and then I submitted all of that. After I applied, the caseworker from DRS scheduled an interview with me. It was about 2 hours, very, very thorough interview. My understanding is that this interview is usually done in the home. So a caseworker comes to your home and does the interview and meets you and meets your adult child on the psychosis spectrum and just sits down and talks. But because my application came in during COVID, my interview was over the phone. Once approved, I learned how to log in and document my caregiving hours. I learned how to call in and call out, how to fill out the timesheet. I learned about how to manage the hours appropriately based on how many caregiving hours my son was allotted each month. I was also given a care plan, and this care plan informed my day and told me all the things that I should be doing for my son, who's considered my customer, and how much time I should be spending on those tasks. So in our case, a caseworker does periodically visit us in our home, and I can always reach out to him. I have come to rely on him for resources and care coordination and support, and that's part of his job. And I feel like I'm successfully collaborating with the Medicaid waiver program requirements and the caseworker. In fact, I'm being paid by the state of Illinois for my caregiving hours, but I'm really working for my son. He's my customer. And at first, this was a little strange because of it altered the power dynamic between parent and child living in your home. But it leveled the playing field in a lot of ways because my son is my customer. I'm working for him. We became much more of a team together, and we collaborated a lot more on his care and his quality of life. The Medicaid waiver program has been such a lifesaver for us. I could go on, but I can't because of time. And I just hope that you are getting enough from me today that you'll be able to apply. Now that we've talked about benefits that are available through the state, let's talk about benefits that are available through the federal government. SSDI, SSI, Medicare, Medicare Part D, the Extra Help Fund. I'd like to say a few words about these programs through the federal government first, and then I'd like to talk about how the state and federal benefits can work together, how state and federal benefits collaborate for our loved ones on the psychosis spectrum. I applied for Social Security benefits after I applied for Medicaid. So the most ideal route to apply for benefits is Medicaid first, Medicaid waiver second, and Social Security disability benefits third. And you don't have to wait until you're approved for each of those before you apply for the next. It's fine if all your applications are pending. If your Medicaid application is pending while you apply for the Medicaid waiver. And if those two are also pending while you apply for Social Security disability benefits. To get approved for benefits, Social Security wants to know that the disabled person can't work and is unlikely to hold down gainful employment in the future. According to Social Security, you must be unable to work for more than 12 months due to symptoms from the disorder. You must be legally eligible to receive disability benefits, and your medical records must establish and prove significant mental limitations. Ideally, the person applying has been unemployed for 12 months at the time of application, with prior years showing that it was a struggle to get and maintain employment. However, this isn't completely necessary. If their work history shows that they have been unable to consistently keep a job due to their disability and they have been out of work several months, you may decide that it's beneficial for you to go ahead and apply before you hit that 12-month mark. I'd like to throw in here that less than 17% of people with schizophrenia, schizoaffective, or bipolar with psychosis can work full-time or can work in gainful employment and be able to support themselves. The vast majority of people with serious disabilities like these are unable to work. The ones that are typically work part-time, but most are unable to work. That's why these disabilities were created for people with schizophrenia, schizoaffective, bipolar with psychosis. They were created for our children with disabilities. Let's talk a little about SSDI and SSI. First of all, what I wish I knew, one application applies to you first. When you put in your Social Security Administration application, you are applying for both of those programs. When I called my local Social Security office to ask about applying, I had the option of applying online or in person. I chose to make an appointment and go in and apply in person. To improve the chances of having my son approved on the first try, when I went in for my appointment, I brought the names, addresses, phone numbers of every doctor and psychiatrist my son had ever seen. I included the dates that he was seen or treated, names of hospitals, outpatient clinics, community health, their addresses, phone numbers, and the dates he was treated. I brought K through 12 school records, including IEP. I brought letters that I had from doctors, bring any neuropsychological evaluations, bring psychiatric assessments or evaluations, bring everything you have, along with the names, dates, and addresses and phone numbers of everyone involved. All of this will go on the application. And you will turn in any hard copies that you have, and they'll make copies of those for you. I think on the online process, you can upload those documents, but I'm really not sure how the online process works because I went in for my interview. On the application, you're going to be asked if you give permission for Social Security Administration to contact all of these doctors and hospitals in order to get copies of records. If you say no, you will be denied for it. It's very likely you'll be denied for benefits. So of course we said yes. Social Security Administration needs to access these records to weed out anybody that's applying fraudulently, basically. They want to make sure that these records are corroborating what you're reporting on your application and what you're turning in regarding of the hard copies of assessments and reports and evaluations that you're turning in. And so you just basically give them permission to have full transparency so that they can see, in fact, that what you're saying is in fact a true, accurate documentation of the disability. They also will need the names, addresses, and phone numbers and dates of prior employment to show that, to be able to show that for my son, that he had not worked in the past year, and that when he did work due to his disability, he was not able to maintain employment. So you'll want to write all that down, and Social Security Administration will compare what you've put on your application with with your loved one's work record through Social Security records. This doesn't mean that it has to be perfect. I can't remember what date my son started a certain job and what's it, but if you can get the date frame, or at least the years, right, that will be good enough. Or if you think, oh, he worked about 6 weeks or he worked about 2 or 3 months, just do your best. And Social Security Administration will compare, and then they'll sort it out to get the exact information. This can be a long process. It can take months to be approved for benefits. It's important to note that while I was waiting, I kept receiving notices from Social Security Administration, and some of them were conflicting notices. And I'm only going to guess. I'm going to take a guess why this happened, because it always freaked me out when I got notices. First of all, anytime anything changes with your case or application, they send you a notice to update you on it, whatever that change may be. So they're going through their due diligence and their process in order to be able to decide if the claim is going to be approved or denied. And they're going to send you a notice every time something is discovered or found. So I wish somebody had told me this. Just be patient. Let them do their due diligence. Let them follow their process. Sometimes the notifications that I get in the mail may not line up completely with the one I just got 2 weeks ago. Just take a breath and let the process happen. Be patient. If you don't miss any appointments, don't miss any phone calls, and return any paperwork they request before the due date. Let's talk about Medicare. 2 years from the date of approval that my son was approved for Social Security disability benefit, he was automatically added to Medicare. It's my understanding that that is routine. Let's talk about DOC and age 22. What is DOC? DOC stands for Disabled Adult Child. If a person is found to be disabled according to Social Security rules prior to the age of 22, they will be considered DOC, a disabled adult child. And this will entitle them to receive a monthly check of 50% of their highest earning parent's Social Security check once that parent is drawing Social Security. This amount is in addition to their parent's Social Security check. The parent's Social Security check is not reduced by this benefit. And this is a lifetime benefit. And after that parent passes away, the disabled adult child will receive 75% of that parent, what that parent was receiving in their Social Security check. And for many, just as a side note, for many DOC individuals, this would put them over the income limit for Medicaid, which used to cause a lot of problems for people. So a law was recently passed that prohibits states from dropping disabled adult children off of Medicaid. So that's not a case. That's not an issue anymore. If you can apply for Social Security benefits before you're 22 or before your disabled child is 22, that's ideal. But if that age has passed, just make sure to submit all the documentation to prove that the disability began before age 22, if in fact it did. If it didn't, there's nothing you can do about that. But if the disability occurred before 22, and for a lot of our kids, the psychosis onset was prior to 22. So as long as you can prove that, your child will be a DOC, will be considered a disabled adult child according to Social Security's rules. Let's talk quickly about what is a QMB. QMB stands for Qualified Medicare Beneficiary. This is a person who receives Medicare Parts A, B, and D along with Medicaid. And you might remember just a few minutes ago, I said 2 years after my son was approved for Social Security benefits, disability benefits, he was automatically moved 2 years later onto Medicare. So once a person starts receiving Medicare, if they're also receiving Medicaid from your state, it is very likely they will be designated a QMB, a qualified Medicare beneficiary. The qualified Medicare beneficiary program pays Medicare premium, pays Medicare deductibles, co-insurance, and Medicare Part D prescription drug costs. QMB is an income tested program, but if a person is receiving Medicaid, it's likely they will qualify for QMB. This program is so important because when these two benefits, when Medicaid and Medicare work together and come together with the QMB program, what it basically means is that the person with disability no longer has any more health costs. All of their healthcare coverage, all their healthcare is covered. All of their prescriptions are covered at 100%. So this creates so much security and for families and for people on the psychosis spectrum to not have to worry about how am I going to pay for this medicine, or how much is my deductible going to be if I need to spend, you know, a month or 2 or 3 or 4 months in a hospital. What's going to happen? What's going to happen? The QMB program covers 100% of healthcare. So QMB, in a nutshell, is Medicare and Medicaid collaborating and working together. From start to finish, it took a little over 2 years for me to secure all of these benefits on behalf of my son. And then at the 2-year mark, he was added to Medicare, and it took about another 6 months for those processes, all the collaborations that had to come together and happen, and all the dust to kind of settle around that. So I would say a total time of for me was 2.5 years. So that's what I have to share with you today about my experience of applying and securing federal and state benefits for my adult child. And before we move on to take questions, I'd like to introduce my host, Ann Cochran, who is the Executive Director of National Shattering Silence Coalition. And then I'd like to share a little bit about my organization, Schizophrenia and Schizoaffective Society, and then we'll be open for questions. So Ann, could you join us now?
Thank you, Heidi. Such an informative presentation. For those who don't know anything about National Shatter and Silence Coalition, I thought this would be a good time just to give you a little introduction. We are an all-volunteer organization. We're a coalition made up of caregivers, peers, and professionals. Some of our priorities include educational awareness, community collaboration, and grassroots reform and advocacy. And again, we are an all-volunteer organization. We do quarterly peer and pro talks. This was a pro talk here. Our next talk will be a peer talk in December, and we will have more information about that coming up soon. We do have a resource guide for members. When you sign up to become a member, that resource guide will be emailed to you and has a lot of great resources available, on that. YouTube channel, all of these videos are posted there, as well as interviews that we have by our media specialist, Eric Diaz, who is a peer and does some wonderful interviews. That is National Shatter and Silence Coalition for the YouTube. We also have support groups, and one for caregivers, one for bereaved parents and caregivers, and one for peers. That information could be found on our website under events. The other thing that I'm excited about that we're doing is we are having a Beyond Stigma campaign that is featuring family stories. This is done in collaboration with the Where Now. And so far we've had 3 stories published. Once we have about 7 to 9 stories, a short documentary will be done with these stories to show that stigma is not the reason that family members aren't getting the help they need. It goes well beyond that. And the last thing that I wanted to mention is we do have state advocacy teams that started a couple months ago. To date, we have, I believe, 12 states covered, and that can be found on our website as well, under the directors page. Our website is www.nsscoalition.org. And I'm going to turn it back over to Heidi to talk a little bit about her organization.
You're doing so much great work, Anne. I'm so honored to be here today and to be part of the volunteer force for National Shattering Silence. Appreciate you so much.
Thank you, and we're thrilled to have you as well.
I'm the founding president of Schizophrenia and Schizoaffective Society. We're an Illinois non-for-profit. And what we are is a chapter-based organization. We bring people together for a weekly private fun event in an assisted non-medical setting. So once a week, we get together with people who have schizophrenia and schizoaffective and other psychosis spectrum disabilities, and we do something fun. We just spend a couple of hours doing an activity or an event on something that is low key and fun. We care about empowering and connecting people with SE and SEA, caregivers, loved ones, advocates, doctors, and providers. We like to bring people together. We care about loneliness. It's a real issue for people among the psychosis spectrum and their caregivers and their families. And so we are completely focused on creating events that end that feeling of loneliness and bring people together for friendship and spreading a sense of belonging. Anyone in the USA can open a local chapter. And now we're on for questions.
Okay, let's see. The first question we have is from Ed. For disabled adults with SMIs in your state who are eligible to supplement their SSI payments, what are the monthly federal and stats income reporting requirements?
I don't know that offhand because my loved one is not able to work. But I know that information is available through the Social Security Administration. If you go on their website and put that in their search bar, it will probably immediately come up.
Okay, next question. Are children of a person receiving SSDI eligible for benefits? The 2 children involved, 9 and 10, have lived solely with their father for the last 27 months as their mother has been ill, hospitalized, or incarcerated due to her illness. The mother and father divorced after mother's first psychotic mania at 36 years of age. Mother is now 41.
Do the children have any disabilities? That would be my question.
Let's see. No.
Then the children would be entitled to survivor benefits. But I don't, off the top of my head, I do not think the children would be eligible for their own specific benefits. But they certainly would be eligible for Medicaid and state benefits. If they're under under the income that's allowed for those benefits.
Okay. So Laurie put in here some information on the Pickle Amendment, and after all that, it says, in summary, while the Pickle Amendment isn't specifically a legal disclaimer for a disabled adult child, it is a key piece of legislation that can protect their access to Medicaid benefits despite changes in the Social Security income. I think this is what you were referring to earlier, Heidi.
Yeah, thank you so much. I couldn't remember the name of it, so I appreciate that. The Pickle Amendment, good. Yeah.
Okay.
Yeah.
Next question. What if my adult child has improved since psychotic episode and is able to help somewhat around the home, but still hasn't been able to go back to school or apply for or secure jobs in the 2 years since the episode? Would we still qualify for SSDI, SSI?
Yes, your adult child would definitely qualify. And I would just like to say that this was something that was very kind of a hard pill for me to swallow as I was applying, because as a mother, I want to focus on my son's strengths, on his gifts. I want to focus on the positive. But when you're going through these applications and these interviews, that is not the time to focus on the positive. That is not the time to focus on the fact that they've gotten a little bit more stable. That is the time to just tell it like it is. And if your adult child has not been able to return to work for 2 years, they are absolutely eligible for these benefits. Please apply.
Thank you. And a question from Laura. What kinds of activities do your groups do? Just curious, how often and how is it set up?
Schizophrenia and Schizoaffective Society is a startup. And so we have one chapter, and it's in the town that I live in Illinois. I'm currently writing the handbook right now. And we are putting together all of that. But I would love for you to email me, because as soon as we're ready to launch and have chapters open up nationwide, which I think will be in early 2025, I would love to be able to send out an email blast and say, hey, we're ready. We've got the handbook. The handbook will outline all the different activities for ideas for meetings. They could be anything from cooking and eating something to doing art projects, music projects, maybe having someone come in that's an expert and bring in some animals or something like that. They can be events that the people who are attending the meetings want to do. They could decide what they want to do. Also, so we're looking for a funding source so that we can finish our 513C designation. And I'm thinking we'll be ready to go in the next couple months. Thank you so much for asking me about that. I've been incredibly lonely during my caregiver journey, and I've watched my son be devastatingly lonely. And this is the reason why I came up with this idea, loneliness. And it's just so heartbreaking.
Yeah, well, thank you for that. Please keep us up to date, and it's something we'll certainly like to, put out to our membership as well, and hopefully be able to get, your groups going up around the country as well.
Thanks, Anne.
You're welcome. Another question from Laura. Will you align with already established NAMI local groups?
Will Schizophrenia and Schizoaffective Society?
Yes, I think that.
Align with already established. Well, I'm in rural Illinois, so we don't have any local NAMI groups, and probably not.
Okay, and just a comment here from Jane. Yes, the isolation is so hard to watch as a parent, and I'm sure even harder to live with for my young adult. And okay, this is a question for me. When will this webinar be posted on the YouTube channel? I should have it up by tomorrow afternoon. And I think that's all the questions here. Heidi, thank you. Oh, wait a minute, let me see. Oh, another comment. Wonderful information, thank you. But thank you very much, Heidi. This was great. If anybody has any questions that they think of after, please feel free to email me at coordinator@nationalshatteringsilencecoalition.org, and then I can get them over to Heidi, and we'll get the answers back to you. So thank you, Heidi.
Such a pleasure. Thank you. Thanks, everybody, for joining.
Thank you.
Thank you. Very
Thank you,
informative. Thank you, Heidi.
Very excellent
Great work.
presentation.
Thank you. It's great.